All right, so I am here with Kendra Olson, who is the owner of Psychotherapy for Maternal Wellbeing.
Yeah.
Kendra, tell us about yourself and your business and what you do in your business.
Sure. Yeah, happy to do so. Thanks again for connecting so we can chat. So I have a private mental health private practice, as you noted, psychotherapy for maternal well-being, and I primarily provide individual mental health therapy for the most part, women, most often that are in kind of that reproductive phase of life. So I see women that are trying to conceive all the way through um, really various phases and stages of motherhood. Um, Supporting their mental health, certainly, right? Some that come in very much in that postpartum time and are dealing with, moderate to severe postpartum depression or anxiety. And I also see a lot of moms, women that are they're just struggling. They're not necessarily clinically depressed or clinically anxious, but they're struggling with motherhood identity issues, just juggling all the demands and I think parenting in 2024 and what that looks like and all the pressures with that, especially on moms. So that's a lot of what's talked about in therapy with clients. And yeah, that's kind of the gist of that. I'm certified in perinatal mental health specifically. So that is an additional training and certification and upkeep to those credentials that just mean like I have that additional training in the perinatal period. So that typically means even trying to conceive, of course, through postpartum and kind of anything in between.
Sure. Okay, will you tell us what psychotherapy means and
Yeah.
therefore like, what a session might look like or what tools you're using?
Yeah, for sure. So psychotherapy is just, it does sound like kind of a fancy big word. I often use it just because when I say I'm a therapist, some people think, oh, are you a physical therapist? Right. Of course, different types of therapists that exist. Um, I guess, yes, I do more often use the term like I'm a psychotherapist or meaning I'm a mental health therapist.
Sure.
So it just means with kind of psychology, therapy within the psychology world. My background is clinical social work, so I'm not a psychologist, but you can practice mental health care as a provider with a variety of different licensures. Mine just happens to be social work. Um, so yeah, as far as like what kind of happens in a session, certainly right, we try to tailor people's care to their unique situations or problems that kind of bring them in. Um, I would say for the most part, right, as people sometimes traditionally think about, it's a lot of talking. Sometimes by me. Hopefully, it's more often, of course, by the client that's coming in. But that also isn't necessarily a have to in terms of like some people just have a harder time if they've never been to therapy before, right? It's a little bit scary. You are telling a stranger until we get to know each other more. You're sometimes, most vulnerable challenges in your life. Um, so part of my job is leading that, especially if somebody's kind of not sure what to share, how to share, or just has trouble kind of opening up. And that can be at whatever pace that person needs. It's not a rush to do that or a certain expectation about it. So we talk a lot about like, of course, what's going on. Sometimes people do find therapy sessions helpful just to like kind of unload what's probably been stuck in their head and maybe they haven't been telling anybody else. But yeah, the treatment part, or what sometimes people refer to as that of therapy, is more about like, let's talk about some coping strategies that might help you deal with, what's troubling you or what you're struggling with. Like, is there an area of your life that like you're not functioning in very well? Is it work? Is it home? Is it taking care of yourself? Really brainstorming, talking about collaborating together, what's going to help essentially reduce your suffering. I think actually the origins of the word psychotherapy, or it, as a verb, right, is like to reduce suffering. Right. And that can, of course, look like all different kinds of ways depending on the person's situation. But that's ultimately our goal is that, you can walk out of a session or maybe you get done doing therapy for that phase of your life. And you can be like, yeah, I know how to cope a little better. I've maybe reframed some of the ways I've looked at the world or myself or my problems differently in like a helpful way. So that's a very high level view, kind of like, I guess, what to expect. Yeah.
Yeah, for sure, which is great because I do think that in the therapy world, there's so many different like EMDR and like all
Yeah.
these different like tools that can be used. And so it's like, what do we,
Mhm.
that's perfect.
Yeah, totally. Yeah. Yeah.
Okay. So I had written down a question like
Yeah.
we I feel like we all know that, or maybe we don't all know, and maybe that's part of the issue, but like anxiety, depression, things like that are like some common mental health struggles that people can struggle with postpartum. But is there other situations or feelings that maybe take people more off guard? Or as I thought about it more, is like, is there a feeling beneath the feeling that is like a little more surprising to people, that you
Mm.
thing that comes up frequently, if that makes any sense?
Yeah. Yeah. No, for sure. Um, I think probably now more so than even a couple years ago, I have moms that at least know about postpartum depression, right? Or they've heard of less commonly postpartum anxiety. That I think that awareness about that being either separate or sometimes comes with postpartum depression is a little bit newer for people, and talking about it as its own distinct set of challenges and symptoms. Um, I think yeah, that's a good question of like what's underneath that, or maybe another way to put it too is like what contributes, even if somebody has, let's say what we'd say is clinical level anxiety symptoms, right? Depression that needs maybe needs medication, is this idea of matrescence. And that is a word to describe, just like we have the word adolescence, think about in terms of like, it's kind of mom's adolescence. That means it is this radical social, physical, emotional, list goes on, change in mom, in the person, right, having the baby. Um, and one, that term literally has been around, I think, since the 70s. I didn't hear it with my two kids until a few years ago. Um, and it's really important and helpful, I think, because it encapsulates all these other things that most women will feel, but sometimes we might attribute to say, like, am I depressed? Do I have anxiety? And sometimes they do, but there's also a lot of times where I see, like, actually, here's a word to label what you're feeling. And within that description is like, sometimes I feel really lonely. I'm feeling a lot of grief and loss about my life before, or that some of this is going away. I didn't think it would go. Again, those identity shifts that happen that are profound, but we don't talk about them. Or we're afraid we should be feeling differently than how we're feeling. So we just tell ourselves, like, I need you to get it together. Like, I shouldn't have these feelings of rage, for example. um, because we aren't using as a society this label often enough, or honoring really, like, wow, mom needs just as much care and looking after as baby does in this life transition.
Yeah,
I
for
would
sure.
say for that's often what's underneath. And like when I can say to a mom, right, have you heard this word before? And a lot of times they have not.
Yeah.
Even if they have, they're like, oh, it is. I mean, it's crazy. I'll watch it. And I felt the same thing myself as a mom. I was like, oh, yes, this is it. Like, this is what I'm feeling.
I love that label, and I've heard of that. The grief and the rage and the resentment, I feel like, is something that I felt. And so it's like to bundle that all up in like matrescence of this transition. And like you might feel all these different situations or feelings. And yeah, I love that.
Yeah.
Same.
Yeah. And it also, like, I think can really help moms not personalize, like, this is a failing within me and this is why this is hard, versus, oh, one, this is a collective experience for probably most moms. And the other piece of that too, I think, is recognizing like the social construction of what motherhood is supposed to be is a social construction, right? It is, we make it up. Like, but I think we do believe in our culture and society, right? Of like, all these things are innate and natural and maternal, and also like this is what you were meant to do as a woman. And there's a lot of challenging that I think needs to happen in terms of like, oh, well, we can like, there's lots of ways to be a mom. There's lots of ways to redefine what that is, but there's so much pressure that comes with being a mom in 2024. Has, I think, for centuries, of course, but like that is a huge piece now. I think, especially with social media, I don't think a lot of moms realize, self included, until I got into it, that I was like, wait, I don't have enough support. What are these gender roles that are like totally against what I would have thought or believed before I got into this? What's going on? Like all the stuff that you just don't see as blatantly, I think, until you're parenting.
Yeah, until you're in it. Yeah,
Mm-hmm.
for sure. Okay, tell me like what your advice is or your stance is on self-care. How do you talk to patients about it? Because like I feel like in my postpartum and even therapy journey postpartum,
Yeah.
it revolves so much around self-care, which kind of just became annoying to be like, yeah, okay, I got it, self-care, like,
Yeah.
but also how? And yeah, tell me more how you
Yeah.
talk about
Yeah. Really good question. I feel like there's been pushback in the last couple of years about like, oh, have we been implying self-care means things like a shower and brushing your teeth, and can't we expect more for a parent, for a mom? Which I totally agree with, right? But I think that the heart of the idea behind like caring for yourself, maybe if we just even change the words of like, how do you learn and figure out how to care for yourself while you're caregiving a baby or children, your marriage, if you work outside of the home as well, you know, I mean, there's lots of things to caregive. Um, that again, I think sometimes when it is boiled down to like, you know, you get to get your shower and you get to brush your teeth, it's still implying like, well, yeah, there's just this level of self-sacrifice that you just have to do because you're a mom. Um, but I think it's really detrimental and it's not enough, right? If we think about what refills your pitcher as you are pouring out of it all day long to care for everybody else, um, taking a shower and brushing your teeth isn't going to be it, probably. It does need, I think, a more nuanced conversation about what really refills your pitcher, specifically uniquely to you. Um, First, identifying what those needs are, because they do vary from person to person. And that can be the hardest part, I think, for people is like, oh, I don't even know what I need. I need something, but I don't know what it is, right? I don't know what to put words to it. Um, and there's very real constraints in terms of time, whether you have support from a partner or a partner that's sharing the load. Um, do you also work outside of the home too? Like, do you ever get a break if you are a stay-at-home parent? Um, that makes self-care pretty hard to do, especially if it's, you know, crying, screaming baby over me brushing my teeth, or saying like, but I was going to go on my hour walk by myself today. And your partner's got a work call. Yeah, like I think we have to be realistic too, like what fits into each person's unique set of circumstance.
that.
And it's such a, I think it's a way broader issue than just like, make sure you have a few minutes today to just be by yourself. That is sometimes where I start with some folks if they have like nothing. I mean, if they describe to me they have zero time off from caring for their baby, or they're at work all day and they come home and they're on, okay, let's baby step here. How do we get you a half hour where you do get to decompress, or you stop somewhere between work and home, right? Or your partner gets home and you say, tag, I'm going for my hour walk now and you're on. I think those are legitimate. That can help.
Mm-hmm.
But yeah, I mean, I get your point about like, it can end up being really trite, right? Like, just go self-care. Why aren't you doing your self-care stuff?
Yeah, right.
That will fix all of this.
Right. I feel like every time I went to therapy is like, well, did you do your self-care things? You're supposed to go to a 1 hour yoga class a week. And did you do it? And I was like, no, I didn't do it. Okay. Maybe that's why I feel bad. Okay. I'll just like make sure I'm doing that. And I guess that's like the culmination of therapy. Great.
Right. Yes, totally.
And
Well, but
also,
yeah, go ahead.
the things you're talking about are exactly right though too, where it's like you do have to figure out how to find those chunks of time. And also, I mean, that's where I wrote down too, is like, how do we get partners involved and what does that look like? Because it does require conversation, I think, to with a
Mhm.
partner to like, okay, this is what I need for support. I am telling you what I need. And first putting a name to that. What is it that I need and
Right.
want? What does that look like daily, weekly, or whatever? And
Mhm.
here's how I'm going to enlist your help to help me get that.
Mhm. Yes. Yeah.
Yeah,
And that can be really hard for us as women to do if we're partnered,
right.
especially in a heterosexual relationship. I mean, research and studies support folks in heterosexual relationships have a much harder time with this because of the traditional gender roles than other identified folks
Sure.
um, that aren't. We don't. They're not subscribing as much, right, to these traditional gender roles, and sometimes even getting a mom to say, "Can you talk to your husband, your partner, about redistributing what this looks like," or being a little more nuanced about like, well, yeah, you're at home with kids all day, you're covering that is a full-time job, just as your partner is working a full-time job out of the house, but that isn't how we look at it, and it is not how we value it,
Right.
especially a stay-at-home parent. We don't value that. We might say we do, but we don't. Right, there's no support, so that it kind of supports we don't actually um, do that in actual practice. And a
Yeah.
lot of parents, moms, that's who I mostly work with, that they take that on, and they are inadvertently invalidating themselves, saying, like, well, this is my job, this is my duty, I'm to cover all this, and just trying to help give them some perspective. A lot of it in therapy is like, what about this perspective? Like, does this work for you? Try it on. What do you think about this? While
Mhm.
still, of course, respecting like your values and what's important to you, and that there's all sorts of ways that can look.
Yeah. Yeah. Love that. Okay, well, tell us where people find you, social,
Sure.
website, whatever.
Yeah.
You need the people.
Um, yeah, physically, you can find me at my office is in Minneapolis, right behind the Walker Arts Center, kind of on the edge of downtown. But I also provide telehealth sessions as well. I do the bulk of what I do is probably telehealth, um, more than anything else. And I am on Instagram. That's PFM Wellbeing is my handle on Instagram. I try to do my best to put out content regularly that hopefully is helpful, at least to some people, in terms of motherhood related stuff there. And then, certainly, yes, of course, my website has probably all the nuts and bolts if somebody's considering therapy or think they might need support. And that's pfmwellbeing.com.
Awesome. Love it.
Yeah.
Well, thanks for your time. I appreciate it.